in long-term care homes. But what's even more staggering is how clear the evidence is that the worst conditions were found.
The federal government is there. The federal government is there with the affordable housing, the national housing strategy. I forget the exact name of it right now. The affordable housing, the national housing strategy. I forget the exact name of it.
Member for Timmins, James Bay.
Thank you. I want to thank my honourable colleague for the excellent presentation. What really worries me when the Liberals talk about their rapid response on housing, what's that going to turn out to be? What, maybe 3 units per community a year? That's ridiculous. In my region, in the city of Timmins, a community of 45,000 people, we have 800 homeless people. When you add the opioid and fentanyl crisis, people are dying at staggering rates, and yet we see indifference. And housing is not just for those who are dealing with the opioid crisis. Seniors can't get proper housing. Families can't get proper housing. So I'd like to ask my honourable colleague about the vexatious way that the Liberals play with people's hopes on housing, but refuse year in, year out to actually deliver a coherent plan to get people proper housing so they can be safe and live a good, decent life.
Is about affordable housing, Mr. Speaker, because we know that many Canadians finding affordable housing was a crisis well before this pandemic, and this crisis has just made things even worse. In my riding, for example, housing prices have soared while many people have been left behind, and nothing in this legislation actually addresses the housing crisis that's raging across our country, especially for many people that have lost their jobs, young people that are already feeling the pressure from the pandemic on their mental health. Many of them working 2-3 jobs just to pay rent, Mr. Speaker. We know that the Liberals have made many promises around housing. It was actually the Liberals that pulled out of the National Housing Strategy, as you recall, in 1993. In the 70s and 80s in Canada, co-op housing, for example, non-market housing in our country was around 10%. In Europe, it's actually around 30%. But today, Mr. Speaker, we're less than 4%. And personally, I know how important co-op housing is because I'm a product of co-op housing. It made a huge impact for me, for my family. I gave my parents a chance. We again can look to Europe and see that they're at 30%. We're less than 4% right now. And the Liberals made a lot of promises that they would, start to invest in affordable housing. We have not seen that promise, Mr. Speaker, delivered on in the community, especially rural communities, Mr. Speaker. I can speak, from a rural lens, and we have not seen those investments, those critical, much-needed investments. And in fact, what the federal government has done is downloaded onto provinces, and in turn, provinces downloaded onto local governments to deal with the housing crisis and this huge vacuum of housing units. And now, as you can imagine, after 27 years, the accumulated need has, become literally hundreds of thousands of units that are needed. And in fact, we hear that there's over 300,000 units needed just for homeless people, Mr. Speaker, never mind working people that are able to barely able to make ends meet and are living in precarious housing. So there's opportunities, Mr. Speaker, and we know that when we invest in local in affordable housing, it helps small business owners. The Chambers of Commerce and my riding are united in that their top couple of priorities, Mr. Speaker, are certainly affordable housing's at the top or near the top of everybody's list. Most businesses can't continue to grow because they can't find employees. Again, the pressure on many working families that are working 2-3 jobs to make ends meet, even small business owners that can't find safe, secure, and affordable housing. And this should be something everybody should have access to, Mr. Speaker. And again, it's about priorities, and governing is about priorities. And this government has, said that they're going to invest in affordable housing, but we have not seen that roll out. We heard their commitment around veterans, Mr. Speaker, and, they made a commitment. We all made a commitment in this House in the last Parliament to end veterans homelessness by 2025, but we have not seen an investment in veterans housing. In fact, there's 2 previous rounds of funding that went by, and the Qualicum Legion cited this in an application to get funding to end veterans homelessness. They needed to get some data to start that planning stage to build affordable housing, like Cockrell House in Victoria, where they house homeless veterans and give them, a safe, secure place to live, but also the supports they need, especially if they've been struggling or suffering from disabilities or from PTSD. That Cockrell House has saved many lives, and there's only one place on South Vancouver Island, nothing north of the Malahat, for example, Mr. Speaker, and they just got a rejection notice from the National Housing Strategy Research and Planning source, Mr. Speaker. And so, I mean, they're just frustrated. They want to help protect those that went and put their lives on the line to protect the most vulnerable overseas, or signed up to serve our country, and they're not getting the support that they need and deserve. And they're looking to make these really important steps, and they're not able to. The other thing that we've seen, obviously, and again, when we're speaking about overrepresentation of people in the housing crisis, obviously Indigenous people. I live in Port Alberni, where 2/3 of the people living on the streets are Indigenous. The overrepresentation of Indigenous people is clear. You can see it any day of the week. In fact, a week and a half ago, there was 38 people we counted in doorways at night in a small rural city, and most of them were Indigenous, Mr. Speaker. And I was speaking to a lot of them. The next morning I was bringing coffee and hot chocolate and some snacks to people that were living on the streets, and having a chance to catch up with them all. And they all had something, in common. Most of them, not all of them, were living with mental health or addictions related issues. They all cited that housing was absolutely number one, that they could not rebuild their lives or get a fresh start without a safe, secure place to live. And, it's so expensive, Mr. Speaker, to have people living on the street. They talked about, their struggles and challenges. We looked at the opportunities and what the solutions might be. And we can look at Portugal, who've done a really good job of, putting the most vulnerable, their most marginalized citizens into housing. They've opened up therapeutic treatment centers, facilities to help support treatment, long-term treatment, because we know, Mr. Speaker, that 28 days is not enough for treatment, and that's still what the government continues to bring forward or offer in most cases in terms of treatment, because they simply can't afford to deal with the issue right now. So we've got, again, downloading onto the provincial governments to deal with housing, to deal with homelessness, to deal with the opioid crisis, and we need the federal government to step up to the plate, Mr. Speaker. The provinces just can't be left any longer holding the bag, and Portugal did that. They said, hey, we're going to get involved, we're going to take responsibility, we're going to lead and be leaders in tackling this really scary crisis when they were dealing with addictions, and they proved that through a strategy of making sure that people had affordable housing and they had safe supports, that they could tackle their issues. They had the highest amount of overdoses and addiction in Europe. Now they're the second lowest. So it's proven that it can work. I also want to talk about the cost of it, Mr. Speaker. And I've shared a story before in the House of Commons about a man, I'm going to call him John. He every day he has an addiction to alcohol. He would drink. He would pass out daily. Fire, police, ambulance would get called. He'd get, ferried up to the West Coast General Hospital here in Port Alberni, and then he'd either stay in an acute care bed or put in cells and then out the next day. And this would happen day after day for years. The cost of this, let's just ballpark it at $2,000 a day, and say that 300 days a year this would happen. That's $600,000, Mr. Speaker. They found a place for John in a low barrier housing unit, nonprofit housing. Of course, BC stepped in, who's building half of the non-market housing in the country. They really need a federal partner, Mr. Speaker. And he stayed there for 5 years. And it was $500 a month to house this gentleman, $6,000 a year. So we have a choice: $6,000 a year or $600,000 a year. For those that think that, we shouldn't be investing in affordable housing and helping those, and that it shouldn't be coming out of taxpayers' dollars. Well, taxpayers are paying already, Mr. Speaker, and it's critical that we invest in this. There was also a really important study that came out, the report of the Blueprint on Crime. And we know many people that end up homeless, or especially those that end up living with addiction, to feed their addiction. They end up stealing or property crime to feed their addiction, to get by, to make ends meet. And they say 80% of all crime comes from 20% of repeat offenders. And someone in that category, a male in that category, typically costs $1.5 million to society through property crime, through the judicial system, the healthcare system. And I see I only have a minute left, Mr. Speaker, because I could speak all day on this. They say that every dollar spent in prevention, in treatment, in health, in judicial reforms, in helping rebuild, people saves this society $12. So we could be saving literally millions of dollars in helping support these people rebuild their lives. But Mr. Speaker, when it comes to housing, we need a robust investment in housing. When it comes to the opioid crisis, thousands of people are dying on the streets of our country. Canada has still not declared, this Liberal government has still not declared it a public health emergency so that the necessary resources are invested. We still have not decriminalized, so people are living with a stigma on what is a health crisis, Mr. Speaker. And we need critical investments in therapeutic treatment centers like Portugal.